Hello everybody, I'm Dr. Jason from Malaysia. Nice to meet you all. I've been using GOURI for the last 1 year plus, so it's been great so far. So generally speaking, in my clinic, we do a lot of skin quality improvement, whereby we actually do treat a lot of fine lines, wrinkles, dull skin, dry skin, and loss of elasticity. So generally, we do a lot of rejuvenation, skin tightening. So with that, of course, GOURI came in and helped a lot in that respect. There is actually an increasing demand where patients want to look natural. They don't want to be overfilled. In fact, they just want to look refreshed without looking unnatural. So this is where actually we started looking at exploring multiple options in helping patients in achieving this. And this is by way of how then we came across GOURI, which is a fantastic product when it comes to rejuvenating and making them refreshed without looking unnatural. So I think I've been doing a couple of hundreds of cases. I don't know exact number. We've started using GOURI since the end of last year, and we've been treating patients on a daily basis since then. And so far, patients have been really happy with the results. Okay. So I think coming from where I've actually tried, or rather we've been doing aesthetic for a long time. We have done energy-based devices like lasers. We've also done injectables like skin boosters, PDRN, hyaluronic fillers. But nothing comes close to what GOURI can offer our patients in the sense that we see visible, very visible skin quality improvement as short as, or rather within 1 month. So I guess this has basically improved on our outcome and patient satisfaction. Oh yes, I definitely have a lot of really nice before and after photos that I can share with you. Essentially, we do see a very significant improvement in terms of rejuvenation, skin quality improvement, just the skin looking brighter, and something that we can't really explain why, but the skin becomes definitely smoother like glass skin, and it becomes fairer. So definitely a lot of cases that we can share. Right. Certainly, with the introduction of cannula, we've noticed a few things. One, definitely pain is lesser because now with the cannula, we can actually approach using a finer cannula and not causing too much of bleeding at the same time. The other thing we've noticed also, there is also much reduced episodes of what we call intravascular event where patients subsequently develop vasovagal effects. So right now we notice patients now have lesser these symptoms, lesser pain, and also lesser bruising as well. Yes. So it is definitely a routine in my clinic whereby patients prior to starting GOURI, they will always have their photos taken and they will always have antihistamines given, in this case cetirizine, before treatment, and immediately after treatment they are also recommended or advised to continue taking the antihistamines for at least 7 to 10 days. Although we see very minimal incidences of swelling after GOURI, but we still recommend that our patients follow through the whole prophylaxis as well. Right. Generally speaking, I think most patients are usually sometimes a bit, they find it a bit troublesome when you ask them to take medication. But of course, if you explain to them in details on why are you doing that, basically it's just to prevent any unwanted swelling. I think most will be able to accept and rather quite happy to go along with it. Because at the end of the day, if they can go back to their social activity without much downtime, I think everyone's happy. Right. So only 2 things, and that also the incidents are actually quite low. So the first incidence was of course the problem of prolonged bruising. This is of course due to technique issue where at the beginning where we were first starting GOURI. We were actually using needle technique, and also some of the cannula. We were transitioning to cannula as well, where we unfortunately went a bit too superficial and caused too much of bruising. So that has, of course, now been improved with better technique. Now we hardly see any prolonged bruising anymore. And of course, the other unfortunate outcome was out of hundreds of patients, we've had 2 patients with a bit of angioedema, where there is actually swelling of the eye, swelling of the mouth, and overall general swelling of the face. But however, that is also pretty transient, where we actually started on some prednisolone, and that actually resolved within 3 to 4 days. Right. So as mentioned earlier, we do prescribe antihistamines for all our patients, and if we of course know that these patients are a little bit sensitive or they have a bit of swelling after most procedures, we will actually cover them with a little bit of prednisolone for just a couple of days as a prophylactics, and this usually helps a lot in managing, or rather reducing, the incidences of side effects. Thank you. 감사합니다.